Dear students, we are going to learn practical 5A in the hospital and clinical pharmacy. The aim of the practical is to study about small volume parenterals and large volume parenterals. You are knowing that parenterals are the dosage form which is mean or which is to be administered by injection, and that's why all parenteral preparation they must be sterile in nature. All parenteral preparation they are sterile in nature. They are sterile. Second thing is that the difference between small volume and large volume parenteral is generally small volume parenterals are administered by intramuscular route. It can be administered subcutaneous route. It can be administered by intravenous route. But majority of large volume parenterals, almost all large volume parenterals, they are meant for intravenous administration, and in large volume parenterals, the vehicle is aqueous. That means the vehicle is nothing but water. They are aqueous in nature, and they are also called as transfusion fluid. So large volume parenterals, they are known as transfusion fluid. Here I have the specimen of a large volume parenterals. This you might have seen. તમે આ હોસ્પિટલમાં જોયેલું હશે. You might have seen in the hospital. This you call it as glucose bottle or normal saline bottle, right? So these are the large volume parenterals meant for IV administration, and they are known as transfusion fluid. Now, what is the small volume parenterals? I can show you. This is the small volume parenterals. This one and this is an ampule which is to be injected intravenously or intramuscularly or subcutaneous route. And this ampule is a single dose small volume parenterals, while this one is a multi-dose small volume parenterals. What is the meaning of multi-dose? You can take many doses from this vial. The cap is opened and needle is pierced through the rubber closure. In this, below this cap, there is a presence of a rubber closure. So when you open this cap, you can pierce or you can forcefully enter this syringe with needle into this one. Needle penetrates to rubber closure and reach here to the injection, and we can take with the syringe. This you might have seen in the doctor's clinic, where 5 ml of this injection or 5 ml of the drug will be taken out and remaining is stored as it is. So here there is a question. What is the question? That this is small volume parenterals and it is multi-dose. So when you use one time, when you use many times, after that there is a question mark for sterility, because as we know that small volume parenterals are sterile in nature. So when you pierce the needle and you use many times, sterility may be lost. And to preserve sterility, in small volume parenterals, multi-dose vial, this is multi-dose vial, where preservatives are added. In this one, preservatives are added. While in a single dose small volume parenteral, preservative is not needed. Preservative or antimicrobial agent. In ampule, it is not needed because it is single dose. While this is multi-dose small volume parenteral, where you need preservative or antimicrobial agent to keep it sterile અને સ્ટરીલિટી ડિસ્ટ્રોય ન થાય એટલા માટે આની અંદર એન્ટીમાઇક્રોબિયલ એજન્ટ હોય. જ્યારે આ જે ઇન્ફ્યુઝન છે લાર્જ વોલ્યુમ પેરેન્ટરલ્સ, in this infusion, or you call it as transfusion fluid, it is also single dose. It is not a multi-dose. It is single dose and it is administered directly into the vein. That means it is intravenous. It also does not possess any antimicrobial agent, because if it possesses antimicrobial agent, this volume is large. As a result, antimicrobial agent, they are toxic and it cross toxic level in our body. In our body, the amount of antimicrobial agent will reach to toxic level. That's why in a large volume parenteral, there is no antimicrobial agent. This is difference. Transfusion fluid, there is no antimicrobial agent. What is the reason? The reason of this is transfusion fluid is a single dose preparation, and second thing is that this is the reason why it does not have any antimicrobial agent, since it is single dose. And second thing is that if antimicrobial agents are used, it crosses toxic level in human body. It crosses toxic level in human body due to large volume of the parenteral. So that's why in transfusion fluid there is no antimicrobial agent. Secondly, small volume parenterals. Small volume parenterals, there are two types. One is a single dose and second is a multi-dose. So in multi-dose, there is a presence of antimicrobial agent. Antimicrobial agent. What is the reason? Reason why it is used? Why antimicrobial agent is added? Because many times drug is withdrawn from bile. Many times drug is withdrawn from bile. Or you can say drug is withdrawn many times. Drug is withdrawn many times from bile. Many times from bile. Hence, to keep its sterility or to maintain its sterility, antimicrobial agents are added. Antimicrobial agents are added. So, why in a multi-dose there is a presence of antimicrobial? To keep its sterile condition, to maintain its sterile condition. Now, what are the other things? That other difference we also learn. Small volume can be given by IV route, it can be given by IM route, it can be given by subcutaneous route. This is difference. While large volume parenterals, they are meant for IV route only. They are meant for IV route only. Here the vehicle in small volume parenterals, vehicle may be aqueous or it is non-aqueous. Vehicle may be water or instead of water any oil is also there. In certain drugs, oil is required to dissolve the drug. So, the water insoluble drug, the vehicle may be oil, and when vehicle is oil, small volume parenteral cannot be given by IV route, where vehicle is oily base. Vehicle is oily base. If it is aqueous base, then it can be given by IV route. So when it is oily or non-aqueous base, it can be given by IM or subcutaneous route. This is another difference between small volume parenterals and large volume parenterals. Now, what are the other properties of this transfusion fluid? What is the other properties of the transfusion fluid? Transfusion fluid is directly administered into intravenous. It is meant for intravenous administration. That means it is directly injected into vein, administered into vein. Hence, first property required, it must be isotonic with plasma. It must be isotonic with plasma. What is reason? What do you mean by isotonic? So, isotonicity depends on concentration of solute. Isotonicity depends on concentration of solute. And concentration of solute decides osmotic pressure. Osmotic pressure. Isotonic means same osmotic pressure. Same osmotic pressure as that of plasma. As that of plasma. Why isotonicity is required? What is reason? શા માટે ઓસ્મોટિક પ્રેશર સેમ હોવું જોઈએ? સો યુ નો ધેટ in plasma there is the presence of RBC. Presence of RBC, and when we inject the transfusion fluid is also called as infusion. So when you inject the transfusion fluid, this surrounds the RBC, right? Because we are administered into plasma. Now suppose it is hypotonic. That means, what do you mean by hypotonic? Osmotic pressure is less. Or osmotic pressure when it is less, because solute concentration is less. Solute concentration is less in this fluid. So what is more? If solute is less, naturally what is more in that one? Solvent concentration is higher. Water is higher, H2O is higher. Solute is less. That's why water enter into RBC. RBC swell, and if this hypotonicity persists means amniotic. If it is maintained, then there is a burst of RBC. What we call it as hemolysis. So if transfusion fluid is hypotonic, then RBC will burst. There is a hemolysis. And suppose this plasma is, suppose you have injected transfusion fluid that is hypertonic. Transfusion fluid is hypertonic. This is RBC. Suppose surrounding transfusion fluid what we have injected into this plasma, suppose it is hypertonic. Hypertonic means what? Solute concentration is higher. Osmotic pressure, OP, osmotic pressure is higher. What is less? Solute is more, so solvent concentration is less. That means H2O is less in a surrounding. And that's why RBC loses water. And hence RBC shrink. And when RBC is shrink, it affects oxygen carrying capacity. That means our cell will get less oxygen. It affects oxygen carrying capacity. And that's why it is required that transfusion fluid must be isotonic with plasma. So what is isotonic? Isotonic means concentration of solute and osmotic pressure is same as that of plasma. If it is hypotonic, then RBC will burst. If it is hypertonic, then RBC will shrink. So, no doubt it also affects our other cells, body cells. That's why whenever you inject any drug into the vein, it must be isotonic with plasma. Second important factor in a transfusion fluid is, second important property of transfusion fluid is
pH of the transfusion fluid. You know what is the pH of our plasma? What is pH of human blood or plasma?
Why we are talking about blood pH? The reason is that we are injecting the drug into vein, directly into blood. That's why pH of the human blood is affected. So what is the pH of human blood? It is around 6.8, approximate 6.8 to 7, what we call it as neutral pH. What do you mean by neutral? Neither acidic nor basic, right? So when we inject, generally our plasma possesses phosphate buffer. Phosphate buffer. This buffer, what is the purpose of buffer? Buffer resists the change in pH. Buffer resists the change in pH of blood. But when you inject such a large volume parenteral, buffer have limited capacity, and that's why the transfusion fluid must have a pH around 6.8. That means the transfusion fluid pH must be near to the pH of plasma. It must be near to the pH of plasma, 6.8 to 7.4. This is required in case of large volume parenteral, because the amount of drug is very high, or amount of liquid to be administered is very high. While in case of small volume parenteral, the amount is very less, right? So much, these two factors, isotonicity and pH, they are very much important for transfusion fluid. Now, what is use of this transfusion fluid? What is the use? What is the use of transfusion fluid? It has many uses, right? Many uses. First, general use as a supplement of nutrients and electrolytes. So when in your body there is a deficiency of any nutrients or electrolyte, generally when this is happened in your body, the nutrients and electrolytes decrease in case of you have dehydration, burning case. So they are used as a supplement of this, or you have trauma, any injury. So in such cases, as a supplement of nutrients and electrolytes, it is used to avoid and to treat dehydration, to avoid and to treat dehydration. This is the second. It is used as a drug carrier. Now, how you say drug carrier? Many times you might have seen, suppose patient is lying on a bed. This fluid is injected into IV, right, intravenous. Directly via syringe or needle, nurse adds some drug into this one. So drug via this transfusion fluid enter into vein. That means this is used as a carrier of any drug.
4. It may be used to promote diuresis. Diuresis. What is the meaning of diuresis? Diuresis means increased frequency of urination. Increased frequency of urination. This is called diuresis.
So to produce diuresis, where it is required, in a congestive cardiac failure, diuresis is required. In any kidney infection, diuresis is required. Right? In case of poison, कोई व्यक्ति है जहरी दवा पी के हो, so to remove poison from systemic circulation, forced diuresis. This is called forced diuresis. So where this is used, it is called forced diuresis. And the fifth purpose of this for expansion of plasma. For expansion of plasma. Where it is required? In case of dehydration, in case of burning, severe burning cases where water amount decrease in our body, in that case plasma expander is used, and to expand the plasma this transfusion fluid is used. So this is about the transfusion fluid.